Good afternoon, everybody. I would like to welcome you all to the first webinar to introduce the HSE's Enterprise Risk Management Policy and Procedures 2023. My name is Patrick Lynch, and I am the HSE's National Director for Governance and Risk and the Chief Risk Officer. Look, thank you for joining us today, and I appreciate your time is valuable, particularly over lunchtime. There are over 1,000 participants registered to attend this series of webinars from all areas of the health service. And today's presentation is intended to be an introduction to some of the fundamental ideas that underpin the effective management of risk. We recognize the variety of those attending today, so wanted to set out how we all manage risk in our daily lives. And we then follow with some of the key concepts contained within the updated policy, and follow this with the training and supporting tools that will be available to you. I hope you'll find it both engaging and informative. So the overall purpose of today is to introduce the policy and to provide you with a very high-level overview of what it says. When we embarked on developing this policy, to which many of you have contributed, we had a number of objectives over and above producing a technical risk policy that meets the ISO standard for risk management. In particular, we wanted to keep it simple, make it understandable, make it relevant and useful to everyone at whatever level or in whatever part of the organization we work, and make it practical. So I wanted just to tackle the idea of enterprise risk management. Look, we hear the terms risk management, integrated risk management, and enterprise risk management used a lot. And the HSE's new policy uses the word enterprise. So what is enterprise risk management, or ERM for short? Firstly, there's nothing particularly mysterious or complicated about the term enterprise in front of the words risk management. It simply reflects the fact that risks in one part of the organization can have an impact on other parts of the organization. So, for example, a clinical incident involving preventable harm to someone who uses our services can affect the public's confidence or trust in the whole organization. A malware attack on our IT systems can have serious consequences for how patient care is delivered, or a fire, flood, and prolonged use of power can prevent essential services from operating. The word enterprise also reflects the fact that risk should be integrated in a more holistic way into planning, decision-making, prioritizing, or allocating resources to reduce risk. For day-to-day usage, and indeed for most of this webinar, we will mainly use the more familiar term risk management. So the policy itself was launched in April of this year following its adoption by the board of the HSE. It's intended to provide us with the language, the structure, and the process for managing risk in a way that is straightforward and consistent across the HSE. It's intended to guide us as we anticipate risks and manage the threats or events that, if they occurred, could prevent or at least impair our ability to fulfill our core objective, which is to provide safe, effective, and high-quality care to the population of this country. So when you look at the policy, and I assume many of you will have read it already, the policy is structured into three parts. The policy section establishes the principles of ERM, including key definitions and roles and responsibilities of key stakeholders. The process section outlines the steps involved in managing risk, including how we identify, reduce, measure, and communicate risk. The procedures section then provides more practical detail in relation to each of the steps in the process, as well as tools that will support us in this work. Elaine, Carol, and Evelyn, who are part of my team here, will shortly be covering some of the key concepts of the policy, but I really wanted just to kick off and start by talking briefly about some of the things that I found helpful, some of the ideas when thinking about risk. They're not the policy, they're not every part of the policy, but just 4 things that I thought you may find helpful. And the first I'll talk about is, what is a risk? Secondly, I want to talk about the fact that risk management is always about the future and not the present. I want to talk about why risks and incidents are so closely related. And for me, an important thing is that having a risk register and managing risk are not the same thing. So the first thought, what is a risk? Well, the official definition internationally, and you'll see it in the policy, is that it is the effect of uncertainty on objectives. So while this is the official definition, it can still sound a bit esoteric. In practical terms, what does it really mean? So firstly, let's look at the 3 words the definition contains. One is effect, the second is uncertainty, and the third is objectives. So you'll hear during today's presentation that each of us will face and manage risk as we go about our daily lives. And these can be the risks we face in our homes or risks we face outside of our homes. So every morning, it's my objective to get to work on time, and I've a plan for doing so. I leave on time, I have my route decided. However, there are many uncertainties that I could face on that journey that are difficult to predict. So while I may have a plan for the 40 minutes it takes me to get to the office, I can't see into the future, even the next 40 minutes of future. For example, there could be heavy traffic, there could be diversions in place, or I could be involved in an accident. Each of these uncertainties could affect my objective, which is to get to work on time. So this is a very, very simplistic example, and one that doesn't reflect what we may face in our jobs every day. The core components, however, effect, uncertainty, objectives, are the same, whatever the risk is, however minor or serious it may be. And none of us took a course in risk management to help us navigate risk in our daily lives. It is for most of us a subconscious and intuitive activity. The things we do naturally and intuitively are fundamentally the same when we manage risk in any other situation. The only difference is that a risk management process provides a structure and framework to assist us in identifying, understanding, and effectively mitigating risks. The next thought is, risk is always about the future, not the present. And I think most of us will hear the word risk used all the time in the health service, certainly all the time in places that I go, but oftentimes it's used very loosely. And what constitutes a real risk continues to be a matter of confusion, resulting, I think, in a lack of clarity about how these real risks should be managed. But there are some features of risk that can help us. And the first I've said, because risks are always in the future, we know that if something has happened or is happening, it is not a risk. So I'll repeat that. They're always in the future. So if something has already happened or is happening, it is not a risk. As we saw already, risk is defined by uncertainty, and therefore an issue, including the most serious incident, is something that has already occurred, and there is therefore no uncertainty about it. And further away in time we look, uncertainties increase and our ability to predict them decreases. That is why often the threats, such as another global pandemic, can be harder to define than the risk of falls by an elderly patient, which can materialize more immediately as serious patient safety incidents. And related to the last thought, and again, it's my experience when I talk to people across the system, risks and incidents are so closely related. Things rarely go to plan. The unexpected happens, and in some cases, the unexpected can be something very serious. Again, for example, a serious patient safety incident, a safeguarding failure leading to the abuse of vulnerable people in our care, an incident of fraud, a major cyber attack, a major fire, or a serious equipment failure. Risks always materialize in some tangible and observable way, which is why today you will hear a lot of reference to what is described as the risk event. Before any of these serious incidents, events, or issues occurred, and whether it was recognized to be such or not, they were risks waiting to happen for our service users or patients who we care for. Understanding incidents and learning from them is therefore an essential part of anticipating and managing future risks. And then the last of the four thoughts relates to the risk register. And again, I just wanted to emphasize that having a risk register and managing risk are not the same thing. Managing risk is exactly that, managing risk. The purpose of risk management is not to have a risk register in case internal auditors or a regulator look for one. Through the process of managing risk, we are seeking to anticipate those things that, if they occurred, could prevent or at least impair our ability to fulfill our core objective, which is to provide, as we've said, effective, quality health and social care services, and to identify and put in place measures to prevent or at least reduce the impact of the risk if it occurs. So having said that, I need to clarify, I'm not attempting to minimize the importance of the risk register. It's very important, but the register is intended to be a useful management tool, similar to the other dashboards we use for monitoring the performance of our services or the management of our budgets. It should become our central repository of critical risk information and, as importantly, provide a record of our effectiveness in reducing risk. So I'll be back to you at the end, but now I'd like to hand over to my colleague, Evelyn O'Shea.
Thank you, Patrick. Hello, everyone. I'm delighted to be with you today. I'm going to discuss risk management in everyday practice and show you that we all manage risk in every day. Appreciating that we all manage risk in our daily lives and how simple this can be is a first step for us to follow the structured approach to risk management as described in the 2023 policy and as my colleagues Elaine and Carol will summarise for us later. We all manage risk every day, very often without realising it. We put a gate on the stairs to protect our little ones. We store and prepare raw food separately from cooked food. We lock our external doors and put on the house alarm going to bed at night. And we place a spark guard in front of the open fire. And we put a lid on our takeaway coffee when carrying it. So risk management is something that we all do naturally and intuitively in our daily lives. And maybe for many of us, we just don't have the language for describing how we manage risk. As Patrick mentioned, a risk is a threat to achieving our objectives. But what does that mean? What is an objective? Let's use the idea of going on a flight to explain it. When we fly, our airline company will have many objectives that will include being safe so that we will arrive safely at our destination, being reliable, our flight departs on the right date and time from the correct location, lands on time in the correct location, and our luggage arrives to the airport with us. Being effective, what is planned to happen when we book the flight is what happens. And being secure, we feel safe from being hijacked or threatened by a terrorist. Of course, these are only a sample of the objectives that an airline might have, and I am using these today to demonstrate in a practical way what an airline industry does to manage the risk to achieving their objectives. They manage the risks of pilot fatigue or a sudden event by having a co-pilot on every flight, the risk of a terrorist attack by limiting liquids to 100 mils, Weapons are not permitted on board. There is no tolerance of violence or aggression, and pilots are closed off from the passengers. The risk of being hit by baggage during landing, takeoff, or turbulence by putting the safety belt sign on and keeping the luggage compartment closed. And the risk of an emergency landing by training passengers on emergency procedures on every flight. In a similar way, we must look at our core objectives and identify what the risks or threats are to us achieving these objectives, and then, of course, manage these risks. Our core objectives may be from the HSE's corporate plan, or our organisation's or our team's mission statement or statement of purpose, or our programme's strategic plan or strategy. For example, the People Strategy, the National Cancer Strategy, the Patient Safety Strategy, and so on. As an example, our core objective might be to deliver evidence-based, high-quality, safe care to our service users. A risk or a threat to achieving this objective might be a risk of a person, a patient, a service user, or a staff member acquiring a healthcare associated infection. Another risk or threat to achieving this objective might be that a critical ICT system will be unavailable due to a cyber attack or a system failure. We all remember the HSE cyber attack in May 2021 that impacted way beyond the HSE's ICT systems and led to massive disruption across all of our healthcare services. In the centre of this slide, we see a healthcare staff member consulting with a service user. The images on the left of the screen relate to the cyber attack and its significant disruption to our health services. Following on from this cyber attack, as seen here on the right, the HSE has made significant improvements in the security and resilience of its ICT critical infrastructure. Mandatory training is available to all staff to improve our awareness. A rapid response is activated to these cyber attack threats when they occur, and proactive preventative measures are implemented against future cyber attacks. We've all, at every level in the health service, learned a lot from this risk event that materialised in 2021, and from other major risk events such as the COVID-19 pandemic and the fire in Wexford General Hospital earlier this year. We know that these events impact severely on the provision of our services, and that in the face of a major crisis, our health service staff can be counted to mount an effective crisis response. However, one of our biggest learnings is that we need to become better at anticipating and preparing for these threats or risks before they occur. To summarise this section, appreciating that we all manage risk in our daily lives and how simple this can be, putting a lid on our takeaway coffee, understanding that keeping the luggage compartment closed during our flight negates the risk of baggage falling on us, and this enables the airline to achieve its safety objective, is a first step for us to follow the structured approach to risk management as described in the 2023 policy. In the next sections of this webinar, my colleagues Elaine and Carol will introduce us to the key risk management concepts from the 2023 policy that provide a structured approach to effectively manage risk and how we can measure the success of our efforts to reduce risk. I will now hand you over to my colleague Elaine Kilroe. Thank you.
Thank you, Evelyn. Good afternoon, everyone. It is great to be with you today. As mentioned, I will be covering two of the key concepts in the policy, that of describing risk and managing risk, before handing over to my colleague, Carol Clark, who will cover measuring risk, talking about risk. So let's begin with the first concept, which is describing a risk. So in describing a risk, there are three essential components. The risk event itself, that is, if the threat materialised, how would you recognise it? What would it look like? How would we experience it? The next, the potential cause or root cause, which starts the event. And finally, the impact or consequence of the event, if it was to occur. We start with the predicted threat. That is a future threat to an objective we wish to achieve. This threat, that when it occurs, will always be experienced in a tangible way. That is an event. What this ensures is that the risk being described is not about an ongoing issue or challenge that is currently being managed. Instead, it is to emphasize that when we are talking about risk, we are talking about an uncertainty that may occur in the future. Next is the cause, which can start the event. This can also be known as the source of the risk or event. Most of you will be familiar with what a cause or source of a risk is, and we want to encourage people not to just list several causes, but instead identify the root cause, that is, the fundamental cause or source of the risk event. This is because understanding the cause is central to deciding how we can best eliminate or reduce the threat, which we will cover later in this webinar. That brings us to the impact or consequence of the risk occurring. This is the final element of the risk description and can dictate the seriousness in which the risk needs to be treated and therefore inform the approach to managing that risk. Again, several impacts may be apparent when setting out the risk. However, rather than listing all of these, it may be decided within your team or unit that it is only the highest level of impacts that will be listed. So now let's look at how all of this comes together. On the screen shows you how a risk description can be set out in a structured statement containing the three elements that we've just covered. That is, there is a risk of the event due to the cause and resulting in the impact. So in setting out our risks, we can then use this method to describe and communicate a risk. I'll now illustrate an everyday example to show you how all of this comes together. We start with the objective of keeping the organisation's physical or digital assets safe. Now, let's describe a risk to that using event, cause and impact. The risk event, a future tangible event that we would experience should it occur, in this case could be unauthorised access to our assets. Where possible, the root cause of the risk event should be identified. In this example, poor access controls could be the lack of security in place in regards to the physical assets, or similarly, a lapse in security measures in regard to our digital assets. Again, a number of impacts may be possible. In this example, we set out the impact being the loss of an asset. With this illustration now shown, here, let's again put it into the structured statement that has been covered. That is, there is a risk of unauthorised access due to poor access controls resulting in loss of property or information. Now, at this point, it's beneficial to see what would be a frequently asked question in this area, where we come across quite often in all of our engagements. One question is, what can help me describe a risk? We hope that what was just covered now is of benefit, and also the following. It is important that you and your colleagues take your time and ask, what is the risk event that if it were to become a reality, could delay or prevent me from consistently providing the safest, highest quality health and social care services? Next, remembering the three components of event, cause and impact in structuring the risk will go a long way in providing a clear and concise statement. And also in the policy, there's further guidance than what was discussed today. In particular, Table 3 of the policy provides a template for the components of the risk description, the structure, and also some guidance on each of the components. That now covers the first concept of describing a risk. I'll now move on to the second concept, which is managing risk. And this is made up of two parts, controls and actions. Let's start with controls first. Controls are defined in the policy as a measure that maintains and/or modifies risk. What is important is the emphasis that a control measure must be in place, working effectively and operating to reduce either the likelihood or impact of a risk. This understanding is crucial when reporting or reviewing control measures, as if the activity being recorded does not meet those above criteria, that is, that it is in place, working effectively and operating to reduce the risk, then it should not be recorded as a control, but instead as an action. I'll talk about actions in just a moment. If we are, however, certain that the measure is a control, that it can be considered if it is proactive in nature, that is designed to reduce or prevent a risk prior to its occurrence, or reactive in nature, that is designed to occur after the risk, and so reduce the impact alone. When looking at the cause of the risk we did earlier, if external, it may only be possible to reduce the impact of the risk, as we are not in control of the risk likelihood. The example is that of the pandemic. We cannot reduce the likelihood of its occurrence, but we can prepare and reduce the impact should it occur. Conversely, if the cause or source of a risk is internal, then potentially we can have more control over both the reduction of the likelihood and impact of its occurrence. So let's look at the different types of controls within these two groups. First, in proactive, there is directive, controls that give direction. Next are preventative, controls that address the root cause of a risk and thus prevent the risk event from occurring in the first place. These are considered the strongest of all controls. Now looking at reactive, we have detective controls that aim to identify a breach after the event. And finally, corrective controls that are put in place after a breach, system failure or weakness, or other gap identified. Let's just take a quick look at an example of this using the previous risk description scenario of unauthorized access. If we were to list the controls in place for this risk, we could set out that we have erected signs that set out certain areas are restricted to authorised personnel only. This would be considered a directive control, as although it gives direction to reduce the risk of anyone without permission entering the prohibited area, it does not prevent the risk unless it is followed. The focus should always be on the identification and implementation of controls that are considered preventative. In this example, it would consist of the presence of security to stop anyone not authorised from entering a prohibited area or prevent any access to an area by individuals without authorised access, such as the security card shown here, to allow access. Detective controls, such as CCTV cameras, capture events after the risk have occurred and can be used to determine that stronger controls need to be in place to prevent reoccurrence. And then corrective controls come subsequent to the risk event and may be considered to reduce the impact of the event. So in this example, data recovery after information lost or activation of an insurance policy for replacement of damaged or stolen goods. So let's just again set out how important it is that control measures be in place, working effectively and operating to reduce either the likelihood or impact of a risk. As I said earlier, there can be a number of measures that can be taken to reduce the risk. Though they do not meet the above criteria, they may be in fact actions. That is a future measure that will maintain and or modify risk. As indicated here, specifically in the HSE, an action is a future measure to further reduce the likelihood or impact of a risk. They are both activities that require resources to reduce a risk, though the fundamental difference is that the control is a measure that is already completed and working to reduce the risk. If it is to be commenced or a work in progress, it is not a control measure, but an action measure. Actions should always be written in a format that is SMART, that is specific, concise and understood by those that are responsible for delivering the action and for those that are reviewing progress on that action. Measurable and, if possible, a metric or status of action should be apparent in order to report on the progress of that action. They should be attainable. The action itself should be possible to be delivered by the action owner and with the resources available so that it can be relied upon to be delivered. It should be relevant. Again, we look to have actions that relate specifically to reducing the likelihood or impact of the risk that is being managed. Finally, time-based. Due to the many competing demands and limited resources, actions should have a set time for delivery in order that resources can be applied accordingly to those actions that may go beyond their deadline. Again, let's look at a frequently asked question that we receive in this area. Let's recap. Controls include, but are not limited to, any process, policy, device, practice, or other conditions and or actions that are in place, maintain or modify risk. Remember, a control must be in place, working effectively and operating to reduce either the likelihood or impact. And also in the policy, there's further guidance that what was discussed today. In particular, Figure 11 lists numerous examples of each type of the control that will assist and provide further guidance. That completes the second concept we covered. I'll now hand you over to Carol Clark, who will cover the further two concepts.
Thank you very much, Elaine. I'm going to cover the final two key concepts, which are measuring risk and talking about risk. So to begin with, to align with international best practice, the 2023 policy has been updated to introduce 3 levels of risk, that is inherent, residual and target. Using the analogy of a tightrope walker, I will explain what each of these levels means. Imagine you're standing at one end of the tightrope, about to attempt to walk across it. The inherent risk is the danger that comes with walking on the tightrope itself without considering any safety measures. It's the natural risk associated with that activity due to its inherent difficulty and the potential consequences of losing balance and falling. Recognizing the inherent risk helps us to understand the need for precautions and measures to make the activity safer. Now, let's say before you begin walking on the tightrope, you receive proper training and you wear a safety harness. Despite these controls, there's still some level of risk that remains. The remaining risk, even after these safety precautions, is known as residual risk. It represents the risk that persists even with control measures in place. Although control measures reduce the risk significantly, there is still a possibility of minor injuries or unforeseen circumstances. Before attempting to walk the tightrope, you establish a target level that you consider to be acceptable. For instance, you might determine that a target risk of no more than 5% chance of falling is acceptable. This means that your goal is to minimize the risk of falling to or below that target level by implementing additional actions such as a safety net, practicing diligently, and taking the necessary precautions. So, to recap, inherent is the level of risk before controls and actions. Residual is the remaining level of risk after consideration of the existing controls. And target is the acceptable level of risk we plan to achieve after the finalization of all of our actions. So, having discussed the different levels of risk, I would like to briefly introduce the concept of risk appetite. Risk appetite is the level of risk the HSE is willing to accept to achieve its strategic objectives. The HSE board has documented its appetite in the HSE risk appetite statement. The overarching risk management strategy leans towards caution and safe options, especially when benefits are limited. The risk appetite statement defines 5 categories of risk appetite, ranging from adverse, meaning to avoid the risk associated and associated uncertainty, or eager, meaning to be innovative and to take opportunities, offering potential higher benefits, despite the greater risks. At a senior, at a senior or national level, risks to the strategic, objectives of the organisation are considered against the HSE's risk appetite statement. Although for the majority of us here present today, the key point to remember is that at a regional, service or individual unit level, the risk to the objectives of our goals are assessed against the target risk rating. The HSE risk assessment form is available to download from the HSE website, and this has been updated to include the new levels of risk, which are inherent, residual and target as shown here. In addition to that, the 2023 HSE Excel Risk Register and revised training manual have also been updated and are available to download from the HSE website. And they also include the new, risk levels. It's burnt, you're going to take a drink of water. Sorry, apologies for that. So the Excel Risk Register has also been updated to include the 3 levels of inherent, residual and targets as shown here. So to assist with the rating of the risks, the HSE has in place the HSE Risk Assessment Tool. Again, this is available in the policy and online. The impact table shown here lists 9 categories of risk. Each category has risk impact descriptors ranging from 1, which is negligible, to 5, which is extreme. Again, to assist with the rating of the HSE has the risk assessment tool, which sets out descriptors for likelihood, ranging from 1, which is rare, to 5, which is almost certain. Likelihood is the probability or the frequency of that risk event to occur. The risk rating is determined based on multiplying the impact score of between 1 and 5 by the likelihood score, again of between 1 and 5, to give an overall risk score. A score of 15 to 25 indicates the risk is rated as high. A score of 6 to 12 indicates the risk is rated as medium. And a score of 1 to 5 indicates the risk is rated as low. I will now step you through a worked example of the risk levels using the HSE's 5x5 risk scoring matrix. In this example, I've identified the risk of a medication error due to incorrect dosage resulting in harm to a patient. I know from my earlier analysis of the risk event that the risk is an operational risk and its source is internal, and it is both preventable or avoidable. The inherent risk level, that is the level of risk before controls, is assessed as 20, being extreme impact and likelihood of likely, as you can see here. I then review the verifiable controls that are in place, such as applying the 5 rights of medication administration, that is the right person, right medication, right dosage, right route, and at the right time. I therefore assess the residual level as 12, with an impact of major and a likelihood of possible. This I deem is not acceptable. I know that I can influence the likelihood and impact by putting in place future actions. I deem for this risk event the acceptable impact is minor and the acceptable likelihood is unlikely. Therefore, my target risk level is 4. I'm confident that my target risk level is both reasonable and achievable, and I deem this to be the acceptable level of risk for the risk event identified. At this point, it's beneficial to see what would a frequently asked question be in this area, which we come across in a lot of our engagements. What do I do after I've assessed the inherent and residual risk rating? Well, very simply, you decide whether that risk rating is acceptable or unacceptable. If acceptable, there is a requirement to monitor the risk going forward. If the rating is unacceptable, excuse me, the risk is transferred, reduced, or avoided. The majority of risks in the HSE will require treatment, meaning a plan must be put in place to reduce the likelihood and/or the impact of that risk event occurring. The final concept that we are going to discuss today is talking about risk. Again, the 2023 policy sets out to clearly articulate the difference between risk communication, notification, and escalation. Effective communication, and consultation enhance risk management. All parties need to understand each other's perspectives and, where appropriate, be actively involved in the decision making. We should have in place clear routes and processes for the communication, notification, and escalation of a risk from one level of the organisation to another. Management teams across the HSE regularly discuss at the level of the organisation for which they are responsible for. This is known as risk communication. Open discussions about risk during meetings helps us to analyse and respond better. It is therefore good practice to have risk management as an agenda item on all management meetings. Risk notification is where we inform higher levels of management about risk so they can decide whether these risks require their attention. Risk notification is an exchange of information to support the decision-making process. It is important to note that a risk notification is not a formal escalation of a risk. When a risk is notified to a line manager, the line manager can decide to accept that risk onto their own risk register. This is known as escalation of a risk. It is also important to remember that the responsibility for managing of the risk generally lies at the level on which it may manifest. Escalation must be subject to formal decision by the line manager, which must be communicated and documented. So to recap, risk notification involves sharing information to aid decision-making without a formal escalation. Risks vary by rating of high, medium and low, with each rating triggering different levels of action and management. Further details are available in Table 9 of the policy to assist in determining the process for risk notification. At this point, again, I think it's useful to look at a frequently asked question in this area. And that is, what will my line manager do when they receive the escalated risk for consideration? And the simple answer is, when a risk is proposed for consideration to a more senior level, that manager may decide not to accept that risk, but to seek assurances in relation to the adequacy of its management, or they may decide that the risk should be included on their risk register. Thank you very much. I will now hand you back to Evelyn.
Thank you, Carol. Hello again, everyone. Great to be back with you. I'm going to discuss risk management training and supporting tools. This slide summarises the risk management training programme that we have commenced. As Patrick mentioned, the Enterprise Risk Management Policy and Procedures 2023 was launched in April. This policy and the supporting tools are available to read and download on the HSE website. The link to watch the launch is also available on the website. Module 1, Introduction to Enterprise Risk Management, is a 30-minute recorded training session that is available to watch. The link to this training presentation is on the HSE website, and I'll show you how to find this in the next slide. We have developed a more detailed overview presentation of the key changes from the previous policy, and we have commenced engagement with quality and patient safety colleagues with this overview training. We are currently collaborating with HSE Land to develop further enterprise risk management training modules. And the Excel Risk Register tool template and related risk register training manual have been updated and are available on the HSE website. The Excel Risk Register e-learning module is available on HSE Land. As I just mentioned, Module 1, Introduction to Enterprise Risk Management, is a 30-minute recorded training session that is available to watch. The link is on the HSE website. Just click on the 2023 HSE Enterprise Risk Management Training as shown here in red. This slide summarises some of the supporting tools, including on the left is the Frequently Asked Questions document and the Excel Risk Register tool that Carol mentioned earlier. These tools are available on the HSE website. The risk assessment form template that Carol referred to is also available to download in Word format. I'll discuss the frequently asked question tool in more detail in the next slide. Detailed information regarding additional support tools, including PESTLE and bowtie tools and horizon scanning, is in the policy, and each of these tools is available as an individual document on the HSE website. Additional training will also be developed on the use of these support tools. Please refer to the 2023 policy or contact the Enterprise Risk Management Programme team on erm.queries@hse.ie with any query you have or support that you require regarding implementation of this policy. We have developed an interactive frequently asked questions document that is available on the HSE website. Click on the 2023 HSE Enterprise Risk Management supporting tools and select the frequently asked questions. Here you can access the questions and answers using two options. You can view the questions and answers topic or categories in the coloured boxes and click on any coloured box on the top left here to view all of the questions that relate to that topic, or you can go directly to the list of questions page on the right here to select a specific question and you will be brought directly to the answer to that question. We will, of course, be updating the online FAQ document after this series of webinars to reflect our learnings from the feedback and queries that you share with us. In summary, detailed information regarding enterprise risk management training is available on the HSE website. Type in HSE risk management in your search, click on the Read the Risk Management documentation and select the training highlighted here in red. Currently, Module 1 Enterprise Risk Management Introduction is available on the website, and we will be adding more training modules over time. The Excel Risk Register e-learning module is available on HSE Land, and we will also be adding additional training modules to HSE Land in the future and communicating with staff when these training sessions become available. As previously expressed, if you have any query or require support regarding the implementation of this policy, please refer to the 2023 policy, our frequently asked questions document, or contact the Enterprise Risk Management Programme team on erm.queries@hse.ie. Thank you. I'll hand you back to Patrick.
Thank you, Elaine, Carol and Evelyn. So we've come to the end of the session. One thing I did want to say, I noticed a few people putting up their hands during the session, and conscious that we have a few hundred people registered for today, and as I say, 1,000 for the series of webinars. It hasn't been possible, which is unfortunate, to have a more interactive session. But it is important for us to get your feedback. If there are things you didn't understand, things you disagreed with, suggestions you'd have to make, can I encourage you to take the time to send queries to the ERM team, and they will be committed to looking at those, reflecting on them and responding to you. So that's a genuine invitation. And I think it's important that we are together learning in this process. So finally, can I thank you for taking this time out of your lunchtime? And I hope that some or all of the session was useful and informative to you. And as I said at the outset, my objective when we commenced work on the policy is we would try to demystify risk. And sometimes my experience is people find or feel that it is more complex than I know it should be. So anything we can do on an ongoing basis to support you in the work you're doing managing risk, we really want to be in a position to do that. So thank you. Goodbye to everyone.